This is the slide of Vermiform Appendix. How do we say that this is the slide of Vermiform Appendix? We can clearly see all the 4 layers of GIT, inner mucosa, the submucosa, then Muscularis externa and Serosa. The mucosa is lined by simple columnar epithelium and has rudimentary crypts. Then Lamina propria contains lymphatic nodules, submucosa contains dense connective tissue, Muscularis externa is arranged in inner circular and outer longitudinal layer, and of course Serosa has mesothelium and subserous connective tissue. This is how we will list the identification points and convince the examiner that possibly this is the slide of appendix. Now let's try to describe the structure of appendix in detail, and we will see about each of the layer in detail. Appendix is a small worm-like organ attached to the cecum. Its average length measures anywhere between 2 to 20 centimeters. Most often it is about 8 to 10 centimeters. The entire wall of the appendix is made up of 4 distinct layers surrounding the lumen, and these 4 layers, as we have learnt, is the inner mucosa, the submucosa, Muscularis externa and Serosa. Let's try to identify each of these layers in detail now. So from 10x magnification, let's shift it to 40x magnification and identify each layer in detail now. So first is the layer of mucosa. As we can see, the mucosa has 3 layers: lining epithelium, then we have lamina propria, and in case of appendix, the muscularis mucosa is disrupted or not so well developed. When we talk about the lining epithelium invaginates in the form of rudimentary crypts. So see, all these are called as rudimentary crypts. Since it is a part of large intestine, we will never identify villi. So these are rudimentary crypts or intestinal glands present within the mucosa, and the lining epithelium is simple columnar. Then we can see lamina propria in between these rudimentary crypts, which have plenty of lymphocytic infiltration. Lymphocytes are a normal finding within the lamina propria. If these lymphocytes are replaced by neutrophils, then it is a case of acute appendicitis, right? So this is regarding lamina propria. If we come further down, as we can see, the muscularis mucosa appears disrupted or not so well developed, right? We can hardly make out muscularis mucosa. This is regarding the features of the mucosa. If we come further down, here we have the dense connective tissue with large blood vessels, which is our submucosa, right? This is a blood vessel, right? How do I identify? Presence of the squamous epithelium or endothelium. Then if we come further down, we have the layer of muscularis externa, where we can beautifully see the circular layer, which is inner, and longitudinal layer, which is the outer layer. So inner circular and outer longitudinal layer is very clearly made out, right? And then if we come further outwards, we see the mesothelium with the subserous connective tissue, suggesting that the entire appendix is covered by peritoneum. So this is how we should go on describing each layer in detail. Once we have done this, possibly the question from the examiner will be, how do you differentiate this from the slide of ileum, which is a common question. Remember, you can get confused between ileum and appendix by looking at the lymphatic nodule. So in ileum, we have something called as Peyer's patches, which will penetrate the lamina propria extending into submucosa. But in case of ileum, you will not find rudimentary crypts, which are invaginations. Instead, you will see papillary projections, which are the villi. That will help you in identifying or differentiating between the ileum and the appendix. What we'll do now is, we'll just shift it to panoramic view, where let's see if we can identify the entire extent of the appendix. See, this is how the appendix looks. The villi should be seen as projections into the lumen. We don't see it here, okay? So this is how you can differentiate it from the slide of ileum. So see the entire view. And when we talk about the ileum, remember the Peyer's patches are aggregated only toward the antimesenteric border, right? So that will tell you whether it is ileum or not. Otherwise, this is how the slide of appendix looks in its panoramic view. This is how you must describe the structure of vermiform appendix.